Is it true that the more men ejaculate, the lower their risk of cancer? And in this case, perhaps prostate cancer.
If you ejaculate more than times in a month versus if you're ejaculating about times in a month, there's a risk associated. There's a reduced risk when you ejaculate in those who ejaculated about times in a month versus those who are ejaculating only about times in a month. But
So does ejaculating more often actually reduce your risk of cancer? This is a question we're going to attempt to answer before the end of today's video. My name is Jessica, this is my YouTube channel, and today I'm joined on the channel by my favorite medical doctor, Dr. Kelvin Owusu. Doc, so good to see you. How are you doing today?
very well, and good to be here as always. Thanks for the invite.
Indeed, indeed. I'm hoping that you can answer all our questions today because I've had quite a number of people in my DMs just saying, hey, the next time you have your medical doctor on, make sure you throw this question to him. And I thought, that's very interesting. I've heard both sides of the argument, but hopefully you can put things to rest for us today.
Hopefully.
Hopefully. Okay. All right. So, I mean, before we even, go straight to answer the question, I do have something that I want to get off maybe my chest or my mind. I want to know, I mean, when it comes to men and just the whole conversation about cancer, what kind of cancers are prevalent where men are concerned?
So, I mean, there are organs that men have that women don't have. So, obviously, when you talk about cancer in those organs, I mean, it's only in men, like the prostate. Women don't have a prostate, even though there seems to be a prostate analog in women, but it's a man's organ. And so, cancer of the prostate is definitely something peculiar to men. But when it comes to general cancers like the lungs, the stomach, we realize that men suffer a lot more lung cancer, probably because they are exposed more to a lot of the toxins. I mean, majority of smokers are men. Majority of heavy duty truck drivers, majority of people exposed to chemicals tend to be men. So lung cancers are more common in men. Breast cancer is common. It's more common in women, but it's more devastating in men. Because we have very little breast tissue. So if it tends to have cancer develop in them, the effects can be catastrophic, even more than when it occurs in women. So these are some of the differences in the two sexes. But generally speaking, the incidence of cancer is about the same after a certain age, because after menopause, women, estrogen drops, and so the incidence of cancer kind of evens out amongst the two sexes in the general areas where we share the same organs.
Right. Okay, thanks for the clarification. So, I mean, when it comes to this topic, ejaculation and a supposed reduced risk of cancer, what kind of cancer are we talking about here?
So typically, we are talking about prostate cancer. I mean, there has been quite a lot of work in that space in respect of ejaculation. So it's predominantly a discussion about prostate cancer.
Okay. Can you shed some small light on exactly what prostate cancer is and why this conversation is really important?
All right. So the prostate gland, it's a gland somewhere between your testicles and the bladder. It's kind of in between at the base of the bladder. So your ejaculatory duct or your urethra actually passes through the prostate when it leaves the bladder. And then when the ejaculatory ducts come in and join the urethra, it also happens inside the prostate or very close to the prostate gland. So the prostate is very, very is intimately related to your sexual function. We don't know the actual role, the specific role the prostate gland plays in your reproductive system, but we believe that some of the secretions of the prostate gland might help in nourishing the sperms. So that's what it does, but it sits in a very, very delicate position. So that's why when a prostate gland enlarges or anything affects the prostate gland, men tend to have difficulty urinating because it's literally sitting at the base of the bladder. Your urethra is passing through it. If there's any enlargement, it can kind of squeeze the urethra, which makes it a bit difficult for urine to pass through. And so it's one of those things. In medicine we say that prostate pain can make a man prostrate. So if you're in the emergency room and you hear a man screaming and crawling on the floor, the diagnosis is almost 100% prostate gland.
Wow,
Yes.
wow. And how does it manifest?
Well, I mean, the biggest or the most obvious challenge with prostate gland enlargement is difficulty urinating. So picture this. You feel like urinating, there's an urge to urinate. You get up, you get to the potty, you try to urinate and the pee is just not coming. It's like that's how terrible it is, and so it causes a lot of pain, a lot of discomfort, and has to be relieved by sometimes passing a catheter through the penis into the bladder to empty it. It can be very distressing. Cancer of the prostate is obviously cancer that develops in the prostate gland, and so and as you grow older, cancer risk generally goes higher as well, and so sometimes, or some people, the changes can result in cancer. And this cancer obviously can kill you because it can spread. And that's what makes cancer dangerous. Cancer spreads. If cancer was not a disease that spread, it wouldn't have been as serious as it is now. But cancer spreads to other parts of the body. Typically, prostate cancer can spread to your spine. And so people with prostate cancer can eventually develop paralysis of their lower limb, or pain, excruciating pain because of the metastasis into the spine. So it can be very, very debilitating, and we don't want to get to that level.
Okay. I have a weird question. Can men function normally without your prostate gland? For instance, is it something that can just be removed and then life continue as usual?
If the prostate gland is removed, I mean, there could be some consequences, like there's probably going to be an increased risk of retrograde ejaculation, which is a situation where instead of when you ejaculate, the semen is supposed to shoot out through the urethra into, I mean, wherever, if it's masturbation or if you're having sex, into your partner, right? Or into the condom for that matter. But when there's retrograde ejaculation, the semen sort of goes backwards into the bladder. So now when the prostate gland is removed, the risk of retrograde ejaculation is a bit higher, but it's not. You see, you have to weigh. It's a risk benefit analysis. Now, if you have prostate cancer, if you don't take out the prostate, you could die. If you take out the prostate, you might have, and the emphasis on might have, an increased risk of retrograde ejaculation, which could have issue and consequences when it comes to trying to get pregnant. Obviously, I mean, get your partner pregnant. But when you weigh the two, death and challenges with pregnancy, I think it's obvious what the option would be. That having a little challenge with pregnancy might be a better alternative in this particular discussion. So it's not something that we can't deal with. We can deal with that.
Okay. All right. So I'm glad you've shed some good light on this whole prostate thing and, how it works and how it affects men inadvertently. Let's have this conversation about just ejaculation and reduced supposed, and maybe this is the point where you can really tell us whether it's a thing that happens. Is it true that the more men ejaculate, the lower their risk of cancer? And in this case, perhaps prostate cancer.
Lots of research has been done, but none has given a clear-cut answer as to how exactly ejaculation affects your risk of prostate cancer. There seems to be an association, definitely, but as to how clear-cut that association is, it's a bit difficult to prove right now. I mean, the biggest research that has given us the most information is a research that was done sometime in 2016, or rather, the result was published sometime in 2016. It had followed quite a number of men, I think 18,000 men over an 18-year period, And what the research sort of concluded was that frequency of ejaculation does actually reduce the risk. So they actually categorize it into a few groups. I mean, if you ejaculate more than 21 times in a month versus if you're ejaculating about 7 times in a month, there's a risk associated. There's a reduced risk when you ejaculate in those who ejaculated about 21 times in a month versus those who are ejaculating only about 7 times in a month. But like I said, it was not a clear-cut, definite results, that you take to the bank and say that I'm going to ejaculate 21 times and it's going to reduce my risk by, let's say, 30% or 20%. We don't have enough information to make that conclusion. But like I said, there seems to be some association between frequency of ejaculation and the reduced risk of prostate cancer.
Okay. All right. So with that in mind, and maybe it might be disappointing for a couple of people to listen to or hear in the video today, but I mean, it is what it is. And I guess 18,000 people over a year or a span of 18 years may not be also a good representative or representation, I should say, of the male population, right? I mean,
Exactly.
if you consider the number of men in the world. But I mean, it is, I think it's still a good study, and it's something worth maybe looking into. The conversation here then should be, what is the, and I don't know if you have an answer, but what is the ideal number of times, would you say monthly, that men have to at least experience ejaculation to feel wholesome?
This is kind of a conflict of interest for me, because I mean, hey, I'm a man, so I don't know if I should answer this question from a male perspective or from a doctor's perspective. But
Do both. Do both.
well, there's, like I said, there's really no at this point, there's no definite minimum that you need to have, to keep yourself from developing cancer in the future. There's really no minimum like that at this point. However, what we do know, and in fact, the reason why there seems to be, or the reason why there's an agreement amongst the authorities that there definitely is a link, is because ejaculation kind of washes out toxins, in the reproductive system or in the reproductive tract. So if you have, the male sex organs are producing semen almost every single day. They are producing sperms almost every single day, right? And if the sperm sit there for a long time, the toxins that you are eating, the toxins that you are breathing in, it circulates through your body through blood. And so the longer it stays there, the higher the probability that some of these toxins are diffusing into the semen as it is being stored in the epididymis and other parts of the reproductive organ. So it is believed that these toxins are the ones that eventually would trigger the development of cancer. So the more frequently you ejaculate, the more frequently you're going to wash and get rid of these toxins out of your system. And so that's one theory as to how ejaculation could reduce the risk of development of cancer. But as to how often you should do it, speaking as a man, at least once a day is good enough. Once a day, every day is good.
Once a day, every day. Wow, you just gave a lot of men a ticket to.
But from a medical perspective, there's really no minimum or maximum for that matter. What we do know is that, I mean, as the more frequently you ejaculate, or the more frequently you engage in sex, which obviously results in ejaculation, the healthier your semen kinda is. So you want to have a healthy dose of sex every now and then. When it comes to a subject like, say, infertility, or couples who are struggling with achieving pregnancy, then we do set a minimum, which is to have sex at least 3 times a week. So if you're not having sex 3 times a week, you are not doing enough when it comes to dealing with infertility or fertility issues. But apart from that, if you're talking about prostate cancer, then there's really nothing in that respect that has been universally agreed by medics.
Okay, let's wrap up this conversation by perhaps highlighting a few ways to maybe improve or manage your prostate as a man. Are there certain things that men can do to make sure that their prostates remain healthy and functional? Would you say?
All right. So now, as a general rule, and this is actually something I've said on this channel before, I don't subscribe to doing a particular thing to keep, let's say, a certain part of your body highly functional. So there's nothing like to do this to keep your prostate healthy, because you have to understand that the prostate is sitting inside a body, and so the general state of that body is important to ensure that the prostate is doing what it's supposed to do and doing it well. So you can't have a healthy prostate in an unhealthy body. And so the first thing you need to do is that you need to make sure that your body is healthy. And for that, you need to eat well. A balanced diet is very important. So, a healthy balance of carbs, proteins, minerals, vitamins, so your fruits and vegetables are very important, because again, it is these fruits and the micronutrients in these fruits and vegetables is what is going to mop up the toxins that end up in your body anyway. So you need a healthy dose of fruits and vegetables in there. Number 2, exercise, very, very important. We talk about exercise for a lot of things. One of the things that exercise helps you is, again, here as well, in ensuring that your body is healthy and can actually reduce your risk of cancer, or cancers for that matter. A good rest is also very important. Stress management. So good rest goes with stress management. So you want to get that also going. It's because when people are stressed, they tend to then indulge in a lot of unhealthy habits like drinking alcohol, like smoking, using recreational drugs, and all these can eventually also lead to development of cancer. If you do smoke, you want to actually cut back and possibly quit smoking, because smoking is associated with cancer in every part of the body, including the prostate. So you want to cut back on smoking as well. So when you do all these things, then of course, on top of that, you can add a healthy, daily dose of good sex to help keep your prostate in good health.
Awesome. Great advice there. Thank you very much, Dr. Kelvin Owusu, for coming through once again. Really appreciate your time, as always.
Thank you very much for having me here, Jess.
All right. So I hope you guys enjoyed the video. If you did, don't forget to smash the like button. Don't forget to subscribe to the channel for more of this content. And if you'd like to link up directly with Dr. Kelvin Owusu, it's very easy to find him. He actually has his own YouTube channel, so check it out if you can. It's at Dr. Kelvin Owusu MD, and I'll put a link to his channel in my channel description, so you can go check out his channel as well. He does some really exciting things. I even saw something about losing weight, and you're on some challenge, are you?
Yes, I am. I'm
helping people lose weight. Awesome. Great stuff there. Keep it up and keep it going. All right. Thank you so much for your time.